All right, welcome back. We're doing part 2, chapter 5, trail guide, head, neck, and face, kinesiology 1. We're going into head, neck, and face muscle group number 2. So these are the hyoids. Now, we're typically not going to be massaging the hyoid muscles, but let's learn them anyhow. That's fun. Right, so you have your suprahyoids. Remember what supra means? Like superior kind of. So we have our geniohyoid, mylohyoid, and stylohyoid. All right. So the suprahyoid muscles are responsible for elevating the hyoid and the tongue. So I'm going to have you look at this bottom picture here. So this bone in the throat here that has all these little attachment dots, those are attachment points. That is your hyoid bone. All right. So, and then top picture, you can see how the hyoid bone, because his chin's kind of up, how it runs from the hyoid bone and goes to the bottom of that mandible. So here is the geniohyoid, right? The origin is underside of the mandible for the genio and the mylo. The stylohyoid originates on the styloid process, that little bone that I told you not to break behind the soft part of the ear. All right. So you can actually see this picture. Let me zoom in so you can see it really good. So mastoid process. This hole here is where your ear is going to be. All right. You have that little styloid process here. Right. Then you have your stylohyoid, so it tells you what it's connecting to and from the styloid, to the hyoid bone. All right. Here's your digastric. Just think gassed, like stomach, bottom of the mouth. Just think you're chewing and swallowing. Okay, that's the best I got for you. So that's the anterior belly, and then here you have your posterior belly back here. Okay, so the insertion point for all these suprahyoids are going to be on the hyoid bone. Cool? Cool. All right, so this one, suprahyoids. Here's the digastric bone, or muscle. When the hyoid bone's fixed, it depresses the mandible. So that would be like where the temporomandibular joint is, TMJ. Now, when the mandible is fixed, it elevates the hyoid bone. It also helps to retract the mandible a little bit. So, digastric right in here. You can see how it would retract that mandible, bring it back if it were in a shortened position. It originates on the mastoid process right here. Deep to the sternocleidomastoid and splenius capitis muscles. So it is deeper to those, connects on there, runs along this direction here, and then it inserts onto, we're over here, inserts onto the inferior border of the actual mandible. All right, so that has an attachment point on the front of your jawbone. Here's another picture here, so you can kind of see. This is its tendon, see? Right on the mandible. Right, you had suprahyoids, which was above the hyoid bone. Now we have infra, like inferior to, below. This would include your sternohyoid, sternothyroid, because the thyroid gland's there, your thyrohyoid, and your omohyoid. Your infrahyoids are responsible for depressing the hyoid bone. So all the bone or the muscles above the hyoid are going to bring it up, right? And then all the ones below it, when contracted, are going to bring it down. Origin for the sternohyoid and the sternothyroid would be the top of the manubrium. So that would be, here we go, top of that sternum, that manubrium. That's going to run, oh wait, let me finish. Your thyrohyoid would start at your thyroid cartilage. So right in here, thyroid cartilage. Then you have your omohyoid is the superior border of the scap. So right in here. And here's a picture of that up here on the top. These are just really deep muscles, okay? Like I said, we're not really palpating these. All those muscles, except for the sternothyroid, sternothyroid, man, it's a mouthful. All those muscles except the sternothyroid insert onto the actual hyoid bone. All right, see right here? The only one that does not insert onto the hyoid bone is the sternothyroid, and that attaches to the thyroid cartilage. All right, fun. So here to here, sternum, thyroid, thyroid cartilage. Woo! Platysma. They call this the lizard neck muscle. So this guy assists to depress the mandible a little bit. It tightens the fascia around the neck. That's why you can make that lizard face, and it draws down the corners of the mouth, as in a frown. It originates on the fascia covering superior part of the pectoralis major. Then it inserts on the base of the mandible and the skin of the lower part of the face. It kind of seamlessly just goes into the fascia. And then, like, we're not really going to be treating the platysma that much. Obviously, any massage is going to address that tissue as well. Okay, let's talk about the occipitofrontalis. So that is a combination of occipitalis and the frontalis, and it is joined together. The origin joins these two together to form occipitofrontalis. So the frontalis part is responsible for raising your eyebrows and wrinkling your forehead. The occipitalis is in charge of anchoring and retracting your gallia aponeurotica tissue here, posterior to the back, right? So that's an anchor for when this frontalis elongates contracts a little and brings that up. Inserts, so they both start at the gallia aponeurotica, the tissue between the two. The frontalis inserts onto the skin above the eyebrow, superior to the eyebrow. Your occipitalis is going to run down and connect to that superior neutral line of the occiput, another muscle that is attached at the occipital ridge there. All right, medial pterygoid. This is one of the mastication muscles. So by itself, it's going to one-sided laterally deviate the mandible to the opposite side. So this is when you're deviating your jaw from left to right. Bilaterally, if both are working simultaneously, it's going to elevate the mandible and protract, so push the mandible out. The origin would be your medial surface of the lateral pterygoid plate. So if you look in here, there's going to be pterygoid plates. There's a lateral and a medial pterygoid plate. And it's kind of right where that sphenoid bone is inside your skull. So you're not ever going to be palpating that because it's deep in the head. Right. It also originates on the tuberosity of the maxilla, so that front bone of the face, bottom picture, in through here. So originates there and runs across and inserts on the medial surface of the ramus of the mandible. So here's that angle, but the ramus right along here. So deep in your skull, and then runs on the inside of that mandible and attaches on the ramus. All right, here's your lateral. So your lateral pterygoid, you can kind of feel this a little bit. So I'm going to go back. Medial is a little bit hard to get to. I don't even know why this picture is right here. That's the wrong picture, but you can't really, so see, this is actually the right side of the jaw, in connecting deep into the skull there. So you're not going to be really feeling this unless you are doing like an intraoral release. Here for the lateral pterygoid, you're going to be able to palpate this a little bit easier when you're just feeling around for at the TMJ. All right. So your lateral pterygoid is another mastication muscle. Unilaterally, one-sided, it's going to laterally deviate the mandible on the opposite side. Bilaterally, it's going to protract the mandible. So your origin here, here's your black on this picture over here. You have a superior and an inferior head. So if you look at this top right picture, you can see how there's two sections for this pterygoid, the two heads. So the superior head above, right, it's going to originate on the infratemporal surface and crest of greater wing of sphenoid bone. So that's going to be deep in your skull on your sinus bone, we'll call it. Your inferior head, so that lower head here, and then I'll look at the top right picture, that inferior head is going to originate on the lateral surface of the lateral pterygoid plate of the sphenoid process. So both the lateral and the medial pterygoid connect on the lateral pterygoid plate. All right. The insertion point. So these two muscles are going to run across and insert onto that mandible there. So they're going to call the articular disc and capsule of the temporal mandibular joint. So there's going to be, a joint capsule around this, ligaments. It's going to run and connect on there, and then the neck of the mandible. It's a fun muscle. It's a muscle, we're going to go back. The lateral pterygoid is one of the main muscles involved with TMJ dysfunction. So any of those mastication muscles, the lateral, the medial pterygoid, masseter, and the temporalis should all be worked on if somebody is dealing with temporal mandibular joint dysfunction. Woo! Okay, so we are going to talk about the longus capitis. You're also not going to be massaging this. All right, if you look at the picture, this is on the anterior portion of your neck, all right? So you're not palpating this. But this muscle is responsible unilaterally for laterally flexing the head and neck to the same side. All right. So left side flexes and it laterally flexes to that left side. It rotates the head and neck on the same side as well. Now bilaterally working together, it's going to flex the head and neck forward. Because it is in the front of the neck, it is going to flex forward. It originates on the transverse processes of C3 through C6. All right, here's 1, 2, 3, 4, 5, 6. All right, and then it runs up. So usually, remember, the origin is kind of usually the stationary part of the muscle. The insertion is where it moves. So that's going to run up the neck and insert on the inferior surface, deep, deep, deep of the occiput. You literally have to pull somebody's head off to massage this. So let's not. So you have your longus capitis, your longus coli. So unilaterally, this set of muscles is going to laterally flex the head and the neck to the same side. Rotate the head and neck to the same side. All right, so usually if you have a rotating muscle, it's going to kind of cross at a diagonal, and that's how you get that rotation. A lot of flexion and extensions tend to be a little more straight. Not always, but all right. Bilaterally, working together, this bad boy is going to flex the head and neck. Again, another muscle group on the anterior neck. So it originates on the bodies of cervical spine 5 through thoracic spine 3. So kind of see these little notches here. And then it's going to run up and kind of connect to the tubercles, right? So we have the transverse processes. It's originated in running and connecting to the red part, which is the tubercle of anterior arch of the atlas, the bodies of the axis, and the transverse processes of C, 5, and 6. So a little crisscross action here. The tongue. The tongue is a muscle. Ooh. Oh, that's all I get. The tongue is a muscle. You're welcome. All right, muscles of facial expression. So a lot of the muscles on your face and some on the scalp are actually responsible mainly for expression. So muscles of the mouth, these would be the buccinator, depressor angulioris. Sometimes they're a mouthful. I can't say them all. Depressor labii inferioris. All right. And these, as you see, the buccinator is going to poof up the cheeks a little bit and help you purse your lips. All right. And then these, says depressor, it's going to bring the sides of your corners of your mouth down. Okie dokie. So we have our levator angulioris and your levator labii superioris. Woo. So those are going to be responsible for elevating the corners of your mouth, levitating them. Then you have your mentalis. So that's at the chin. This is when you pout. Those little muscles help kind of draw the corners down. So you have muscles that draw the corners up, and you have muscles that draw the corners down. Good stuff. All right, orbicularis oris. If you see oris or usually it has to do with mouth, oral, got it. So these are going to be muscles that are also responsible for pulling, like kind of forcing a smile or pulling the corners of your lip away from each other, or pursing the lips as well. So orbicularis oris, that top right, you have your platysma, this is lizard neck, and rhizoarius, right, in the cheeks here. Okay, muscles of the mouth. These are some smiling muscles. So zygomaticus major and zygomaticus minor. These are going to bring the edges of the corners of the mouth up to form that smile. Now we have some nasal muscles, right? Levator labii superioris. It's going to, bring your nose, scrunch it up, right? Alicae nasi, nasalis, and procerus are always, those are the flaring muscles of the nose and the scrunching of the nose up. You probably won't ever see these muscles again, not gonna lie. Okay, muscles of the eyes. So you have your corrugulator supercilia, which is furrowing of the brows, and then your orbicularis oculi. If you see ocu, you were talking about eyes. orbicularis. Orb always means it's a circular or sphincter type muscle. So this is going to be responsible for closing the eyes. Scalp muscles. Occipital frontalis. Remember, that'll raise your eyebrows, and you have the occipitalis as an anchor. And then you have your auriculatus muscles. So these are the muscles that are aura, auditory, ear. These are the muscles where some people have more control than others, but they can wiggle their ears. All right, so that's the posterior, superior, and anterior muscles around the ear. Apply your learning. So you guys can go ahead and look at the slides in your book too, and your trail guide workbook as well, and kind of start trying to identify some of these facial muscles. All right, let's look at some ligaments just for funsies. Ooh, this ain't a ligament. So we're going to have a deeper look at the common carotid artery. So remember, the carotid is in that anterior triangle of the neck. So you can see when you're doing SCM work how, and this is deep to the SCM, how you could possibly pinch off the supply of the carotid artery. Again, if you feel pulse, let go from that spot and move on to a different area. All right, so carotid artery kind of running front of the neck there, kind of right along that SCM. Then we have something called the superficial temporal artery. So you guys had probably seen when, usually it's easier when bald men or bald people get angry and this artery gets real big. So that's what you're looking at, is that superficial temporal artery. So again, if you're feeling a pulse when working on somebody around your temporalis, let go. Right, so we have our facial artery in your face here. It branches off that carotid artery in that front of the neck there. It kind of runs up and supplies the face with the blood. An important nerve in the face would be the cranial nerve 7. So the cranial nerve 7 here is an important facial nerve, and here it shows you external auditory meatus. So it can help with auditory issues, parotid gland. The facial nerve has a lot of functions. Vertebral artery. So this artery branches out the subclavian artery to supply blood to the brain and the spinal cord. So you'll see it kind of runs kind of along the inside of all those transverse process. Parotid gland and duct, submandibular glands. So you guys can actually feel a lot of glands, and also a lot of times when you're sick, the doctors are kind of palpating around your mandible to see if any of your lymph nodes or glands are inflamed. All right, so one of your salivary glands that produces saliva is right under the edge of that ramus, that corner of your mandible. And here's a deeper look here. You have your masseter, parotid duct, and then the gland right behind. Your thyroid gland. So here's that little butterfly-shaped gland, which is your thyroid, and that's sitting kind of in the front of the neck. If people are dealing with like thyroid issues like thyroid cancer or goiters, we're generally not going to be working around the throat like this anyhow. All right, so your head also has some lymph nodes. You've got lymph nodes everywhere, but here are some common lymph nodes that are in the head and the neck. So your occipital and mastoid nodes are around that mastoid process in your occipital region, right? Your below mandibular nodes, so right under your chin here, you can feel, that's where your doctors are feeling. A lot of times you can kind of feel right under the mastoid process, and these guys are inflamed. And then you have your supraclavicular nodes as well, that is right above your clavicle. When we're doing lymphatic drainage of the face, typically those supraclavicular nodes are going to be the nodes that we are opening up before we start the whole process of lymphatic massage. Here's a better view of the brachial plexus. So just so you know, here's that clavicle. Down here it says the clavicle's cut to show the brachial plexus path. Generally, this clavicle is going to be in front of all these structures, right? And then connects onto the sternum. So the brachial plexus, which is in yellow, right? You see how it's intertwined with your scalenes, right? And then you have your pec minor that could be tight and kind of push on the brachial plexus. So if people are dealing with numbness in the hands, fingers, down the arm, or anything, we're going to want to try to address all these neck and chest and back and shoulder muscles to kind of see if the numbness, the nerve dysfunction is coming from tension in the muscles. Excuse me. So the brachial plexus innervates the shoulder and the upper arm, which is why there might be numbness if there is pinching somewhere along that route. It exits the transverse processes of C5 through T1, all right? Kind of low neck, upper back, but front. This is the front of the body, right? And it runs between the anterior and the middle scalenes. So that's why when we are working the scalenes, we are working the scalenes when dealing with thoracic outlet syndrome, which would be what's happening with the brachial plexus being pinched in some way. It also runs under the clavicle to the axillary region. So imagine this clavicle is, back in business here, not cut in half. You have all these nerves that form that plexus that run under the clavicle and then run underneath the pec minor, and then it goes into the armpit. So that's the brachial plexus. Apply your learning again. Kind of take a look at this, fill in the answers in your trail guide workbook, and try to see if you can do it first without looking. All right, we're good. Till next time.